Hi there, I'm Jonathan Abraham, CEO and co-founder of Healum. Thanks for joining us for this fireside chat today. I'm joined by Anuj Saboo, our Chief Technology Officer, and I'm joined by Dr Adrian Heald, who played the role of Chief Investigator in a recent study that we did. Today, we'll be talking about our journey from creating a product and doing that in partnership with healthcare professionals and patients, through to then the work that we put in to evaluate that product and how we engaged with the wider research community and how we found a group of primary care sites that helped us to deliver that research and what we will now do as we go forward into the future and what our research and development roadmap looks like. I'll hand over to some intros. Anuj.
Hi guys, my name is Anuj Saboo and I'm the CTO and co-founder of Healum. Really glad to be joining this fireside chat with John and Dr. Adrian Heald.
Hello everyone, I'm Adrian Heald. I'm an NHS physician. I'm based mainly at Salford Royal Hospital in Greater Manchester. My speciality is diabetes and endocrinology. And as Jonathan said, I was involved as the chief investigator for a study that has recently been completed. I'm independent of Healum, but work in collaboration with them in relation to not just ongoing research, but also how new and innovative strategies for digital can be included in care packages for patients in the National Health Service.
So we've seen some great results from the randomized control trial, but it's important to take a step back and understand where we first started, why we're doing what we're doing, and some of the real problems and challenges that we uncovered and what the role of technology is in addressing some of those challenges. For us as a company, the role of technology in supporting people to understand the best possible choices and the best possible actions that they can take during their daily lives is the reason that we get out of bed in the morning. It's the purpose of our company in supporting healthcare professionals and human beings that are trying to manage their health, to understand what are the best possible actions to take in their daily lives to improve their health, and to help them understand what they are and make it easy to take action. The primary problem that we saw, particularly for people with type 2 diabetes, which crystallized a lot of the other problem statements and the real challenge for them, is that in a given year, there are 8,760 hours in the year, which we have the pleasure of living in our lives. Only 4 of those hours, on average, are spent in front of a healthcare professional across your full spectrum of treatment and care that you'll receive for your diabetes. That leaves many other hours, 8,756 hours, where you are spending the rest of the time to try and manage your health in your daily lives. And we heard from people in numerous different communities that they struggle, firstly, to get help and support in those 4 hours of care from those healthcare professionals. Secondly, for that care to be joined up in a way that they feel is personalized to them and where everyone in the loop of their care journey is connected and recommending a consistent plan of care and support. The third element is when they're then living their daily lives, it's really challenging to remember and to act on all the many things they need to do, from taking their medication to eating the right food to ensuring that they're getting the requisite exercise and eliminating stress, and even learning about their type 2 diabetes.
Long-term condition management is something that takes up a lot of time. for the individual and requires appropriate support from healthcare professionals. Many people with type 2 diabetes also have other health conditions to manage in association with their diabetes. We live in an increasingly digital world, and that applies to older people as it does to younger people. And what is apparent is that there can be ways that we can support individuals in terms of how they manage their conditions, particularly their type 2 diabetes, in their day-to-day lives, in between those critical points of interaction, those appointments with their healthcare team in primary care, in general practices, in family doctor practices. And the notion that we had was that actually an app, a digital support solution that would sit on their telephone would be able to give them prompts and advice and access to resources on a day-to-day basis. But importantly, that wouldn't just stand alone, that the software would actually link directly in a completely secure way into the GP records, so that the care planning that is done intermittently for people with any long-term condition could align with goals that would then be manifest in the application, the software application sitting on the phone. And we're interested to see not just whether the addition of that digital solution to usual care would help people to manage their diabetes more effectively, but also how that approach would be viewed by healthcare professionals, how it'd be viewed by the patients themselves, and ultimately whether people would use it. Final thing to say is that we know that around 25 to 30% of people with diabetes are not month to month hitting target with their glucose levels. Glucose isn't all of it. There are other things that have to be managed, such as blood pressure, such as blood cholesterol. But the sugar management is absolutely pivotal to success of management of type 2 diabetes and to the avoidance of complications in the longer term. So if we can have the sugars right, then often other things will fall into place. And this is where the app comes into its own.
We asked ourselves that what if any person suffering from type 2 diabetes could get support between appointments with their doctors. So when they are outside of the clinical environment during those 8,756 hours, how technology or digital could support them. What if people suffering from type 2 diabetes had a better understanding of their diabetes and their general health? We thought, what if every person suffering from type 2 diabetes had a personal and dynamic care plan that they could hold and access at any point in time, which made them feel supported and cared for and gave them some clarity and better understanding. What if we could help them navigate the chaos of information of what exactly, what do they need to do and what choices do they need to make, and how we can make sure that all of their healthcare professionals, doctors, nurses, knew their care plan and also knew what, as an individual, what they were doing in order to manage their condition. So these were some of the problem statements that we came across through our co-creation process. Personalized care planning has already been proven to be effective at improving the health of people with diabetes. Effective personalized plans are broad in scope and then required like a joined up care across multiple different care settings. Interventions that are delivered across a broad set of care settings could include drugs, procedures, educational strategies, social prescribing, statutory and non-statutory services, diet and lifestyle advice as well. So it's quite challenging to incorporate all of these into a plan, which is personalized for a person in a traditional setting, and that's where the technology and digital comes in, which helps not only solve these problems, but also helps people get a better experience of their care, not only within the clinical setting, but also outside. Healthcare professionals, working in primary care setting, were able to use a desktop web-based software in order to create a personalized self-care plan for the individual they were consulting with. The software helped them focus on the actual consultation, and take a very empathetic approach, and approach it with a much more holistic view of what the patient could do in terms of setting some goals, in terms of monitoring and tracking certain aspects of their lives, and also the care plan could have things around education, some lifestyle resources that people could read, which were relevant to them. They could look at some of the things around recipes that they could actually use and make them themselves when they are struggling with some food choices. Beyond that, the patient was also given, the people suffering from type 2 diabetes were also given access to an app which they could use anytime, anywhere on their phone, on their smartphone. And as soon as the plan was shared with the individual, it was readily accessible with the person. They could from that they could sign up and set up their own goals, monitor things like their weight, their activity levels, and beyond that, it also gave them daily actions that they need to take up or perform, which help them nudge towards better self-care and better engagement with their own health around managing their type 2 diabetes.
Well, firstly, we designed it to be integrated with the electronic health records that the GPs, nurses, anyone in primary care already uses. Secondly, we designed it to be quick, simple, and easy to use. And that is a tough design challenge in itself. Took many years to perfect and get right, but we had a brief of how could someone be able to share personalized information in less than 30 seconds, and how could they create a care plan in only a couple of minutes. Thirdly, this is a solution that combines together medical and self-care options. And lastly, we designed this solution so that it could incorporate multilingual resources and help these systems to particularly address health inequalities and make it as easy as possible for those primary care teams to put directory of services that could aid people from many different communities to see what was available locally in their areas to help them. As a company, we had to consider several different aspects of whether our product is actually achieving what it set out to. Firstly, we had to look at health outcomes. Has it actually, after being used, does it improve the health outcomes for people with type 2 diabetes? Normally, those are measured by their blood glucose, but also looking at their blood pressure and their BMI and several other factors which Dr. Heald can elaborate on. So that was the first thing. We had to look at, did it impact their quality of life? Did they feel better after using our products? Did they feel that their care was more joined up and connected? Thirdly, we had to look at the different use cases of the functions within the app. the test results, the daily actions, the goal setting, receiving the videos and articles from healthcare professionals. We wanted to understand where in people's lives, in their moments, did they find those things useful? What impact did it have on their behavior and their confidence and ultimately their actions? And then lastly, we also then had to look at what the experience of the healthcare professionals was like. Were they using this? When were they using this? What sorts of things were they assembling into a care plan? And if one takes a step back, as well as trying to figure out whether all of this actually has an impact, the desired impact, in the healthcare space, there are a set of evidence standards which the National Institute for Clinical Excellence, NICE, has put together for digital health technologies. And 5 years ago, we were fortunate enough to be on the Digital Health London Accelerator and had some great advice from people like Professor Paul Wallace, who helped us to understand what those evidence standard frameworks were telling us needed to be investigated for a digital health intervention like ours, which is classified as a tier C intervention.
If you look at our product, I think we have two sets of audiences. We have healthcare professionals who are using one part of our product, and then we have individuals and people who are suffering with certain health condition. In this case, type 2 diabetes, who are using another part of the product, and both parts of the product have sort of different pain points. And our one of the key challenge for us was to how we use our co-creation philosophy to come to a common ground and help resolve some of these key challenges for both the healthcare professionals and individual patients. First part of our evaluating is looking at the user experience for both healthcare professionals and patients, doing a lot of research, and this involves, as I mentioned previously, talking to the individuals. So we spoke to about 100 or so healthcare professionals and about 50 or so patients over the last, how many, over 2 years. So, talking to them, trying to find out and understand their journey, their pain points. After that, I think the next step was looking at certain different specific hypotheses and coming up with some simple design experiments and design prototypes in order to see whether are we able to, even using these concepts and ideas, are we even able to address the problem at hand that we discovered while speaking with healthcare professionals and patients. I think the next major part of this stage is continuously getting feedback. So performing, usability testing, interviews with qualitative and quantitative interviews and surveys with people to understand one, whether it was simple enough for them to use, second, whether how did it make them feel, and third, did it have any kind of impact in terms of when it comes to healthcare professionals, did it make their life simpler and help them take care of their patient better. I think one of the other aspects is for us to evaluate how actually is the product helping them, and that is underpinned by looking at the usage statistics, engagement statistics, behavioral statistics in terms of why people are doing certain things and what exactly are they achieving. And a combination of that and looking at the data and coming up with certain insights is how we would evaluate if certain idea, concept, or a digital solution is truly working or not.
The evaluation of a digital product is going to be different than a pure clinical intervention. The classic one, as you say, is a new tablet to treat a condition. And the methodology, still at the highest standard of evidence, needs to involve a randomized controlled trial, and that's exactly what you proposed and what we implemented, having gone through the appropriate assessment by ethics committees and by the HRA, the England body that governs research conducted in the NHS. And what we did was to look not just at clinical outcomes, but also, in other words, quantitative outcomes, but also at qualitative and semi-qualitative outcomes as well. The critical point about the approach was that this is an add-on to usual care. We weren't trying to test it out in comparison with perhaps a dietary intervention or an exercise intervention. It was simply added on to the usual care that's delivered by practice nurses across United Kingdom, across Europe, across many parts of the world on a daily basis. And we wanted to see whether the addition of this software solution would actually enhance the outcomes for individual, but also determine what the experience of the individual was, using some validated scales regarding quality of life, but also to hear from the individuals in a series of interviews that we conducted what their view of the solution was, and kind of living with that digital solution on a day-to-day basis. As Anuj and Jonathan have said, the critical point about this, and this relates not just to the application for diabetes management, but more broadly in relation to its application beyond diabetes to multimorbidity management, is ease of use, and also an ease of the care planning that feeds into the interface that the patient sees day to day through their telephone.
So combining the traditional randomized control trial approach, looking at patient quality of life, looking at patient activation and management of their care, looking at the utility for the healthcare professionals. All of these aspects are key in the study design, and Dr. Heald and some of the wider NIHR team helped Healum as a company to be able to design a protocol that incorporated all of those important elements of efficacy and quality of life and impact on behavior, with a study design that enabled us to also validate some of the product use hypotheses that are important and typical when looking at the process of research and developing a technology product. Primarily in the UK, if you are going to do any kind of research, there are three organizations that are incredible: the Health Research Authority, the National Institute for Clinical Excellence, and the National Institute for Health Research, the NIHR. The NIHR, throughout the whole process of designing the research, creating a consortium to help us deliver it, trying to find funding, trying to then set up the research in a way where we were meeting all of our obligations as a sponsor, trying to navigate the complexities of recruitment, and prior to that, navigating through ethics committees, finding the right human beings that could be, and professionals that could be involved in the process. These were all things that we were incredibly lucky and grateful to have received from the National Institute for Health Research. Along the way, we faced some huge challenges. We faced challenges when it came to, after finally getting started, to recruiting patients. We had a strategy which was to recruit patients through primary care sites, often and previously done face-to-face through that human trusted contact. And we started delivering the research in the middle of the pandemic, at the start of the pandemic. And the NIHR and Dr. Heald as our chief investigator were incredibly helpful in helping us to understand a different method of recruitment in the context of the pandemic as to how we might achieve those numbers. The NIHR also helped us find some additional sites across Devon and the Southwest who were great in helping us to achieve some of those numbers. But more importantly, they helped us to understand how we might also adapt our recruitment strategy so that that worked within the changing nature, particularly during the pandemic, where more patient consultants were done remotely. So we've spoken about the research protocol and what was appropriate, and we've spoken about all the different partners that helped us. So now we come on to the results of the study, and Dr. Heald will talk us through some of the clinical results that we saw, and then that will be followed by Anuj Saboo, who will take us through some of what the product analytics told us.
Thanks, Jonathan. In total, we had 197 participants in the randomized controlled trial, slightly more in the active treatment group who were using the Healum software on their phones than the control group. And in both the control group, which is the usual care group, and the active treatment group, which is add-on to usual care of the Healum software, there was a slight preponderance of males to females, of men to women. I've already touched on the results. We looked at HbA1c, which is the measure of average blood glucose control in both the active treatment group over a 6-month period, and also in the control group, the usual care group, over the same time. And what we saw was a significant reduction in HbA1c, the measure of average blood glucose control over the 6 months that people were using the app, with actually very little or no change in body mass index. There was no reduction in HbA1c for people who were under the usual care intervention during that period. Next slide. And we've also mentioned quality of life, and this looks at both the overall quality of life score using a measure called the EQ5D5L. The purple is a quantification over several domains of quality of life and activity and day-to-day experience of their condition. The EQ-VAS is a visual analog scale, and both for the quantitative measure across several domains of life experience, there was an improvement in quality of life for people who were in the active treatment group using the app, and also an improvement as rated on a visual analog scale that runs from 0 to 100 of their quality of life. There was actually a slight decrease in both the overall analog score for people who were using who were not using the app, in other words, who were in the control group, and no significant change for the overall quantitative domain score. So just to reiterate again, for those who are in the active treatment group using the software solution, there's an improvement in the quantitative score across several domains of quality of life, but also an improvement in the visual analog rating of quality of life on a scale of 0 to 100. There was no significant change in the quantitative EQ5D5L score for those in the usual care group, and in fact a slight decrease on the visual analog scale of the overall rated quality of life. When we go on to hear from some of the participants about their experience of using the solution and experience of the care planning. Next slide, please. The we must frame this by saying the conversation between patients and healthcare professionals was really focused on what really mattered to individuals in terms of their care planning. A wide range of health objectives would be set in the software. These are some of the objectives that people set. One person said to live as long as I can. Another person said I want to try and build back up stamina to do daily activities without effort. Another person said I'd just like to be healthier in general, to be more active and to lose weight. And another person said I want to achieve my HbA1c to be under control with the aim of coming off tablets. Great idea. If you lose enough weight, if you can exercise more, that certainly is actually a possibility. Next slide, please. And this is some of the feedback that patients gave after they'd experienced the Healum software. One lady said the act of thinking and capturing goals, I think, was really good. Before this, I didn't feel as if anyone had asked me those questions. The gentleman said, I think that the app is a very useful tool. It has the right things on there to help and motivate you. Another gentleman said, having the app has made me feel more motivated. Before, whenever I went to the GP, it was all about the drugs I must take, and that was it. I wasn't ever really told about the things I could do myself to help my diabetes management. However, during the care plan appointment and having the app, I was informed about other things I could do. It has been a helpful reminder to do things myself to help my health. I think hearing from patients is always the most valuable thing. We can look at the numbers, we can do the stats, we can do that qualitative interview stuff, but actually to hear what people wanted out of their care planning, to hear their experience of the app is worth more than anything else. So hopefully those comments are helpful to you in terms of understanding how this solution has really made a difference to people's lives and their experience of managing their long-term conditions.
Thanks, Dr. Heald, for taking us through the clinical outcomes. So those were the clinical outcomes and qualitative outcomes. But what did the product analytics, tell us? So one of the things that it told us was patients had a better care experience from additional support through the app. So we see that around 2,078 app sessions were completed by the patients. At least 30% of the users had used the app 10 times in the first 30 days. And at least 84% of the users had used the app at least 2 times in the first 30 days. Multidisciplinary teams were able to also better motivate and educate their patients. So we see that around 5,396 times educational content and resources were shared by healthcare professionals using the software. And these were, some of the resources shared were like diabetes management resources, well-being resources, lifestyle resources. Around 1,084 diet and well-being resources were shared. Around 499 physical activity resources were shared as well. And then approximately 262 resources were shared, which were related to stress and anxiety. On the patient side, when it comes to goal setting, 280 total goals were shared as a personalized care plan. And these ranged from various different things like I want to get out in nature more. One patient set a goal about fit into my evening dress for the diabetes fundraiser. One lady had a goal about to be healthy enough to have a safe pregnancy. So we were able to gather quite a lot of rich insight into how personalized these care plans were. I think on the patient side, patients were able to manage their health in between appointments and get support on the plan that they had set in consultation with their with their GP. So we see that approximately around patients set about 343 goals for themselves. In total, 2,483 health markers were tracked across the entire patient population. Amongst the patient population, 1,021 different actions were completed, and 2,000 2,284 times patients viewed resources that were shared with them by their GP or healthcare professionals. This supported patients to make healthy choices each day without putting an extra burden on healthcare professionals. So as I said earlier, 1,021 actions were completed. What this means is that a patient decided that as part of my personalized care plan and diabetes care, I'm going to do certain actions either on a daily or a weekly basis, and these patients were able to complete 1,021 such actions. Some really powerful and common actions that we could see in our data were things like 47 times an action such as less biscuit, less cake, or more whole grain was completed. Be mindful of the carbohydrate intake of meals as a reminder to themselves was completed 45 times. Consider alternate exercise. For example, swimming was completed 44 times. Try to get to bed earlier was completed. Such a simple action was completed 46 times. I will do more steps during the day was completed 49 times. And just to remind themselves not to use iPad was completed 36 times. So as you can see, there is a varying range of things, actions, healthier choices that people are making around their daily lifestyles, or even just to take care of their sleep or mental health and mental well-being. Primary care staff were able to better understand their patients' needs and progress better in the next appointment. Since everything that is tracked and the progress that the patients make between the appointments is instantly available to the healthcare professional through the software, they were able to see that in total 2,483 times any specific health markers were tracked. Some of the popular health markers were weight. So weight was tracked by the patients 465 times. Steps were tracked 402 times. People tracked their water intake 301 times. People tracked their sleep and 278 times. People even tracked how much fizzy drinks they were consuming. It was tracked 276 times. People tracked their meals 272 times. People tracked their alcohol consumption 171 times. And just to be more mindful, people track their mindfulness as well 154 times. So this is just a short a summary of some of the key health markers people tracked as part of their personalized care planning. And primary care staff were better able to understand the educational content, services, and actions that were actually helping people to better manage their diabetes. So as I said earlier, through the software, instantly the healthcare professional can see what's working and what's not working. So when it comes to educational content, resources were viewed 2,284 times, and some of the popular content was a recipe called for kimchi pasta, which was viewed 49 times. Just normal HbA1c and the education around what is a normal HbA1c and setting the record straight was viewed 44 times. And another recipe of 1 minute omelette was viewed 87 times. So as you can see, I think this suite of product analytics numbers not only supports but also the clinical outcomes that Dr. Adrian Heald talked about, but we can also see how people are achieving those outcomes through this quantitative analysis. And it has not only helped us to see what is working and what's not working, but it has also helped us to iterate and imagine what are the other experiences that we can bring to our product, which will further help people better manage their health condition.
What we aim to do, and this has been now supported by an award for the Small Business Research Initiative in the United Kingdom, the SBRI, is look at a real-world study where the Healum solution is applied to the overall management of people with a range of different conditions, or even conditions plus risk factors, and helping them and the healthcare professionals in the team to look at a pathway forward to a future that hopefully will not involve them having a major event 20 or even 30 years down the road, where they'll be able to keep going with those choices that will mitigate the risks of them developing a serious condition in the future. So we're looking forward to the Healum app being part of multi-morbidity and multi-risk factor management to help healthcare professionals, to help individuals to manage their health in a proactive way, and also ultimately for this to be something that makes a very positive contribution to the experience of people in their interaction with the healthcare system, particularly with primary care, as they go forward through their lives.
So thanks, Dr. Heald, for giving us a perspective on the follow-on research that's being conducted into multi-morbidities, patients at risk of cardiovascular disease, and how we're incorporating health economic analysis, clinical utility, and looking at the real-world experiences and how the software and app combined work together to achieve some of the clinical benefits and some of the patient benefits as measured by their experience and behavior, and looking at whether all of that's value for money. As a company, over the past 5 years, we've observed how the use of our software and the use of our apps by patients helps us to understand a lot about the choices they're making and the actions they're taking. From our software, we're able to see what healthcare professionals put into our software as being relevant for the care plan for patients, whether that be the medication or the services they're referring them to, or the health educational material they're giving them, or the videos they're sharing, or the recipes or exercises, or whatever goals and actions that they're setting jointly with patients. All of those are important learnings about what healthcare professionals believe are the optimal strategies and interventions for those patients in their daily lives. And on the patient side, we're learning about what goals they're accepting and completing, what objectives they're setting, the actions they're taking each day, the kinds of resources they're engaging with. And all of this information helps us to understand the shape of the actions and choices that people are taking each day to manage their health. So after a period of time, we started to see what if actually we could use all of this data to help aid healthcare professionals in making decisions about people's care. What if people could use this data and insights to better understand their own health and to also support them in making choices in their daily lives, whether that be to manage their diabetes or to lower their blood pressure or to lose weight or to better manage any other kind of risk factor that they've got around their health. So in this real world study, we decided that we would incorporate the element of analytics and insights into the real world research protocols that we're writing. So it'll help us to look at each day what are the most useful and helpful interventions for people when managing their health. It'll help us to understand a lot about their lived experience and some of the challenges they've got. And we saw that there was a potential to bake this element of research, insights, and analytics into the product that we're offering GP practices, into the product that we're offering the national commissioners who pay for technology to be used in primary care, so that all of that data and insight is not going to waste. It's helping healthcare professionals to make better clinical and non-clinical decisions at the point of care in advising patients what they should be doing and putting them into a plan of care and support that those patients can have with them at all points in time, and also to better support patients to make all the choices in their daily lives about whether that's the medication they're taking and the things that they're doing in terms of their diet and exercise. And we saw that this could give us the potential to show healthcare professionals and patients what has worked best for similar types of patients to them that might come from the same background or community or might have the same combination of risk factors or diseases or conditions, and also to help them understand what's been most popular, not only what worked, but what's also been most popular. And that concept, that ability to surface those analytics at the point of care and at the point of action for a human being led us to form the live learning network so that we could aggregate all of this insights and data together, give people and their healthcare professionals the tools to be able to manage people's privacy and consent around it, to give them an active choice as to whether they wanted that data to play a useful part in their health, and then to provide all of those insights on a continuous basis into the apps that patients use and the software that the healthcare professionals are using to help pull together those plans of clinical and non-clinical care and support. The challenge of being able to understand the best set of choices and interventions for people is a huge and complex one. Anuj, could you perhaps explain the role of technology and how our product roadmap and our research and development efforts might evolve in order to help us to achieve that?
Thanks, Jonathan. Yeah, sure. So I think if, as we spoke earlier, one of the key things that we want to do is enable people to make healthier choices. But if you look at the world today, in this digital age, we are producing a lot of data. So there is health data, there is environment data, there is data people are generating about themselves. So there are a lot of choices which are accessible through the internet, through all sorts of channels and mechanisms. How does one find out what is actually working? People from what we have seen, as we spoke earlier, people are finding it difficult already in terms of how they manage their health condition when they're outside of the clinic, and there are so many choices to make. So I think one of the key aspects, that we would like to focus on is how to make these things, these choices simpler. So not only make them relevant for the individual, but the other aspect is also to provide some of the similar choices that may have worked for someone else, which may be useful to me as well. So I think with all this data, it's not possible to just do it with traditional technology or traditional techniques. And that's where machine learning comes in, where we are able to train the technology to look at the data, understand it, and then make some relevant suggestions and recommendations.
We've talked today a lot about the co-creation process and the work we did to co-design and develop solutions for people with type 2 diabetes. The role of evaluation and research and how important it is to be doing that for patients, for healthcare professionals, for commissioners, for any stakeholders involved that can get benefit from products to improve health outcomes, improve quality of life, and improve clinical efficiency and the experience of care for patients. We've spoken about how it's important to combine together the traditional methods of clinical research with product methods for research that help you to determine not just the impact you're having, but how we're having that impact and whether the specific use cases that our product supports are actually coming to fruition. And then we've spoken a bit about the role for real world evaluation and understanding clinical utility, value for money, and the experience for patients, the role that that plays in our company's future and in how we will evolve. And we've spoken a little bit about how our proposition is unique in that it generates lots of insights that can help people and healthcare professionals to understand the best possible clinical and life choices that people can make to live the healthiest and happiest lives. And today we have shown that we will be continuing that research into the future, and we're giving any primary care networks across the UK the opportunity to opt in to our live learning network. And that means that your practice will get access to the software and the patient-facing app, and you'll be able to understand what your peers have been recommending to patients, the kind of care plans they've been pulling together, the medical and non-medical interventions that they've been putting together for patients who've got different comorbidities and patients who come from different communities and have different preferences. You'll be able to see on demand what's worked best and what's been most popular, and you'll be able to be part of a learning and research network that will generate lots of useful conclusions and hopefully great advice at the point of care. So if you'd like to sign up, then you can email research@healum.com. It's up there on the screen. If you want to talk to any of the team to get a product demo, then you can also email partnerships@healum.com. And we would love to have you join this journey with us and with the many patients that have been using the software and the apps and got a lot of benefit out of it. And we see that going forward over the next 10 years, particularly as we're looking at machine learning and the continuous use of data and insights to provide better care and support, we believe that this live learning network will be very well placed to be at the forefront of ensuring that people can have consent and that they their privacy is respected, and that we can generate the kind of learnings that will contribute greatly to understanding the role of choice and the role of activity in improving people's health outcomes. Thank you very much for engaging and listening today. And please do get in touch at research@healum.com or partnerships@healum.com. And we look forward to working with you. Thank you.